My name is Dr. Cooper Dykstra. We're located here in Sioux Falls, South Dakota. Our clinic, Brain Health and Chiropractic, is focused on complex neurological cases, and we utilize our 4-day brain reset program to help these cases. We see adults and pediatrics. With a lot of our adult population, we'll see chronic dizziness, post-concussion syndrome, dysautonomias and POTS, head pressure, and balance issues. With our pediatric population, we'll see a lot of ADHD, autism, emotional dysregulation or behavioral issues, and coordination issues as well with kids. What's different with functional neurology than traditional chiropractic is we're looking at the circuits in the brain, the wiring in the brain. And there's nothing wrong with chiropractic. Like chiropractic care is amazing and I use it every day here. But with functional neurology, we're looking at all the different systems in the brain. So we're looking at the eyes, the vestibular centers, the cerebellar centers, the frontal lobe. How are we balancing and those sorts of things. And I think the reason that there aren't as many chiropractors doing this stuff is because of the time it takes to learn this stuff and the business model of like, because you need to do a lot of intensity, like high intensity therapies with a lot of this. And you do have to have a practice built out to have all the tech, all the tools and equipment that you'll need to help kind of push that healing response. And if you're going to do a care plan in 4 days. My unique approach here as a functional neurology chiropractor, I have a couple different lenses because I was a patient dealing with a lot of these symptoms and a practitioner now. It can be hard to communicate some of these things because you can't see it blatantly, like a lot of these findings. I like to use the example like a broken arm. If you have a broken arm, you can clearly tell that it'll be swollen, it'll be not the right direction, you'll have a cast on it. With a headache, you're not going to necessarily see those symptoms on someone, right? I mean, sometimes like they'll maybe not be in as good of a mood or like not want to take in like light and noise and stuff like that. But what we do here is like asking specific questions, like during our exam, like, does your head pressure feel like pressure from the inside out or squeezing around the head? Those are two separate systems that can give you those types of headaches. Like a classic chiropractic one is the neck pain headache that wraps up around the back of the head. All of those can tell you different parts of the brain that aren't working well, and that's going to change the entire trajectory of your care plan and what we work on in the office. I think traditional chiropractic can be a great place to start with care after a concussion and stuff like that, even because like there is like, I mean, if you whiplash your neck or jar your head, like there's going to be stuff in the cervical spine that's going to be off. Um, but if you are having persistent symptoms, our clinic does a really nice job on chronic issues. Like you've done all the testing, you've tried chiropractic care. And it's not that you can't come in here at the beginning, but like we do a really good job after like you've kind of checked some of the boxes off on some of the easier things to try first, like chiropractic care or even some supplements and stuff like that. Because we'll do a very deep dive into the care, looking at the eyes and the vestibular centers. Like I'll just walk you through one example. If you whiplashed your neck or got a concussion, your eye posture could be off. Like if the brainstem got affected, the posture of your eyes could be off. So you could have one eye up and one eye kind of straight, not even like necessarily visible to everyone. But because of that, your head is going to start compensating for that so you don't get double vision. And so with that compensation, you're going to have chronic neck pain. Like, I go to the chiropractor, I get adjusted. I have like, I feel good for like a couple hours after that. And then it starts coming back. Well, it's not a neck issue then at that point. It has to do with your posture centers in your eyes or your vestibular centers and stuff like that.
Hi, I'm Dr. Natalie Haken. I grew up and born and raised in South Dakota. I attended University of South Dakota and went on to study chiropractic school at Northwestern in the cities. What drew me to pediatrics specifically is I love working with the younger population and knowing that any change we can make to make their life easier at this age and stage follows them and impacts the trajectory of their life. So like many other chiropractors, my healthcare journey has impacted my decision to become a chiropractor. So I had some significant health struggles in middle and high school, and that led me to seeking out chiropractic care. I actually had a professor in college that said, do you know that some of the things that chiropractors can do? And that kind of took me down a route, seeing some other specialists that looked into functional medicine and applied kinesiology and things like that helped me tremendously. And then that got me searching for what else is out there? Like, what about the brain? What could we be doing to impact that, to influence that? I got in touch with Dr. Cooper, and that changed the trajectory of my career as well. Once you learn about functional neurology and the impact on the organ that controls everything can have on your body, and how you can influence that through therapy, and looking at the different systems that impact attention, focus, balance, all those things. You can't unsee that, and you have to learn that information. And so just me specifically knowing the impact that optimizing these systems can have for kids was just a driving force. And so I had to continue to learn everything I can about that. So something that you can't ignore once you understand it is how the eyes impact our ability to focus. How our eyes working together as a team to track, as we're reading, as we're driving, as we're playing sports, as we're running, as we're walking. So if you understand that the eyes can impact all those systems together, you have to learn about how to get them to work better as a team.
When I was 2 years old, I started having seizures, and that was my first experience in life. Obviously, I don't remember it a ton, but that was my first experience in life. Going to the hospital, getting my labs drawn, doing EEGs and everything. So, at a really early age, I started experiencing kind of this health runaround that I see a lot of patients deal with today. As I got older, I took medication for 2 years. I really didn't get any like magic help when I was younger. I took medication for 2 years and my seizures were gone after that. So I did have a lot of help with that. When I was going into my freshman year of high school, I got in a car accident with my dad. I got ejected out of a vehicle and I was paralyzed in my left leg for about 6 weeks after that. I went to a chiropractor, I went to a PT, we did x rays. I couldn't move my leg, but I had no abnormal findings. And so I kind of became a medical mystery at that time. And granted, like I didn't have a long time with it, but 6 weeks at that age, I loved basketball and it like really, really affected me. And I didn't know if I would be able to play basketball again or even walk and stuff at that point. After 6 weeks, with lots of prayer and bed rest, I started walking. I was able to move my leg again. And from what I understand now, I had a lot of inflammation around my hip and my nerves in my leg that did need some time to subside. And that's why I didn't show up on any imaging and stuff like that. Um, but yeah, no, everyone was kind of scared of my case because it was kind of complex and no one wanted to adjust me. No one wanted to do exercises because I had a very spastic leg and everything. So that shaped a lot of my career in, man, like I really could have used some help if someone would have just tried some stuff and it just no one was willing to do it. And so originally was going to be a physical therapist and that wasn't the route for me and so I kind of happened to get it. Went to chiropractic school. One of the things that drew me to chiropractic school was the philosophy of chiropractic that the body has the ability to heal itself. I kind of took that as, that's my own story. Like I didn't really have any like crazy medical stuff that helped me. Like the body did heal on its own because we're programmed to heal on our own as long as we promote it in that right direction with the neurology. When I was in chiropractic school, that would have been about 10 years after my 8 to 10 years after my car accident. And so because I was at that age, like as a teenager, with lots of changes and stuff going on, I didn't really understand like how much of it was actually due to my concussion from the accident too, because I was so hyper focused on my leg issues. I dealt with really a seasonal affective depression like every winter. I mean, it's not a joke, but it was a joke. Like with my college friends, like every February, I would be like down in the dumps. Like my mood was terrible. It just made no sense to me. So, but it was like clockwork. Every January, February, I would get in a really bad mood and everything. Head pressure, 8 out of 10 head pressure that I didn't even really realize I had until it went away when I started doing the functional neurology care in chiropractic school. So as I started learning about the nervous system, I was taking a course in chiropractic school called the central nervous system, CNS, and I started understanding like, hey, this is the control centers of everything in the body. So if we wanted to make like good global changes with the body, we should probably figure out how to push that in the right direction to help the body heal. And so that's when I really started diving into functional neurology, kind of understood that, hey, there's a technique, it's functional neurology, to help rewire the brain and make changes. A case that's really stuck with me in the office was a 52-year-old man that was dealing with post-concussion syndrome for 20 plus years. But he didn't really know that the concussions were leading to that. He always thought it was stress with work and everything because he had a lot on his plate with the job that he had. So it was actually a referral from a dentist. and he had a lot of jaw pain and tightness and everything. But as you went further into the case, there was a lot of anxiety and issues taking in lights and noise and those sorts of things, like getting overstimulated, lots of head pressure, all blamed on stress. And so when I was doing the exam, I was just like, I'm like, man, this is post-concussion syndrome. I'm like, when did you hit your head? He's like, 20 years ago. I'm like, no way. And the symptoms haven't let up since then. Thinking it's a tooth and stuff with the jaw pain and everything. So we did an exam. We started getting his eyes to stick on a target better, got his balance better. As we started getting the eyes better and the balance better, his neck started to loosen up and his jaw started to loosen up. Another thing that he had is from his concussion, his left side of his body wasn't communicating with his brain. So his brain didn't know where this side of the body is. So like for an example, like after someone has a stroke, like they'll get spastic like that on that side, right? Well, if you were to strip the muscles out and loosen up the muscle, like is that going to fix the issue? The answer would obviously be no, because the issue is coming up from the brain. So as you start remapping these pathways and getting the brain to communicate with this part of the body, like the left side of the body, the muscles will start to relax again. So we did a lot of therapy like that, and he is doing awesome. So he doesn't get stressed out with work. He doesn't have the headaches. He doesn't get the neck pain, the jaw pain, and his life is forever changed after the care. If you've had a concussion or a whiplash injury or anything, any sort of injury like that, or a metabolic injury of some sort, like an autoimmunity or viral injury, some of the symptoms that you may be dealing with is head pressure, either head pressure from the inside out, like a balloon expanding or squeezing of the head. You may be dealing with like chronic dizziness. One of the most common types of dizziness that I see in the office is not necessarily vertigo, like where the room is spinning, but where you constantly feel like if your eyes are closed, you'll feel like you're rocking on a boat. When those systems are weak, you'll have a harder time getting blood flow up to the head. And so when you can't get proper blood flow up to the head, your heart's going to start having to pump a little bit harder. And this is where you get into the POTS and dysautonomia talk with some of this stuff. Um, because your brain's not interpreting gravity very well via those systems. So then your heart has to work harder to push blood flow up. My core belief at Brain Health and Chiropractic is that the body can heal itself. So if we can take the body and the brain out of a state of fight or flight and start rebuilding the foundational structures in our brainstem and our cerebellum, build a better foundation in our brain, we'll start promoting a rest and healing response in the body and start to see major changes in the body. Because remember, the brain is our control center for the entire body. So if we build a nice, strong structure for that and balanced system, we're going to be able to promote a rest response throughout the whole body. When I'm thinking about the relationship between the brain and the body, I'm thinking about all the different types of receptors. So we have different receptors, proprioception in the feet. We have receptors in the gut that tell us our internal perception. We have receptors to tell us where we're at in space when we're moving our head side to side. If those systems and those sensors aren't working well and taking in good information, we're going to get a thing called mismatch. The more mismatch you have between the brain and the body, the more symptoms you'll have because you'll create a compensation response or a fight or flight response with that mismatch. So as we start taking away and start creating better sensory matching, we're going to start creating better function in the brain. So neurology is just a simple term talking about your nervous system, which is going to consist of your central nervous system and your peripheral nervous system. The central nervous system is your spinal cord and your brain, and your peripheral nervous system is going to be your peripheral nerves that come out of the spine. Functional neurology is looking at the nervous system in a state of function. So I like to say the example, like if you were at a gym and you're with a personal trainer and they were assessing like where the weak muscles are and those sorts of things, we're doing that for the nervous system. So if you had a weak bicep, you'd start doing more curls. If you have weak tracking to the left, like following a dot from right to left, you would actually want to do stuff like vibration and body-based movements on the right side of the body. So those are some examples. I see my role as a functional neurology provider versus a traditional provider in a way to, number one, to offer something different to the patient that has tried almost everything. Functional neurology is a unique approach, and I think offering something different to patients can go a long ways, especially when you've tried every supplement under the sun and every exercise under the sun. Looking at a combination of vision therapy, vestibular therapy, chiropractic care, low-level laser therapy, hyperbaric oxygen therapy, and combining those in the intensity of care um, can really offer a different outlet of care for those patients. A common myth that I see in the office is that salt can fix POTS, and I just don't see that to be the case. With POTS, there's a lot of lack of integration with the gravity centers and a lot of cerebellar findings that help integrate those systems to help you interpret gravity. So when you stand up, you can get blood flow up to the head. They will help that, but it's not the root cause of that. With Parkinson's specifically, we've seen big changes with decreasing in the tremors, better balance and better gait control. A lot of times with Parkinson's, you'll see a stooped posture forward and a shuffling gait, making it easy to trip and fall, like getting your foot hooked on the rug or the carpet or anything like that. So when you get better smooth movement and there's not as much tremor and rigidity throughout the body, like smoother range of motion, reflexively, once that system's going, you can start feeding it more, and going for a walk is actually therapeutic. But when the system is stuck in the tremor and the rigidity, it can make things really tight. So once you get better range of motion, you'll have better gait function, better balance, and less tremors and tightness throughout the body. Our Brain Reset program is a 4-day intensive program where we do 2 hours of therapy and an hour of hyperbaric oxygen therapy each day for 4 days. Now, I know it sounds kind of aggressive, but the intensity of care makes a big difference with neurological conditions. So I like to use the example: if you play basketball, if you shot one free throw a day for 30 days, you probably wouldn't be that much better at shooting free throws because you only shot once. But if you shot 500 free throws for 4 days straight, you'd be quite a bit better because of the muscle memory and the reflexive nature of that. So the intensive therapy is really directed towards people who have a lot of imbalanced findings on the exam. So we don't just do brain reset programs on anyone, it's indicated on our exam. So if there's a lot of imbalances, POTS and dysautonomias do really well with the program. Post-concussion syndromes and chronic dizziness do really well with the brain reset program. After the brain reset program, you're given home exercises to keep working on at home, along with some lifestyle and dietary changes to create as much individual care and independence from your health conditions as possible. My name is Dr. Cooper Dykstra. We're located here in Sioux Falls, South Dakota. Our clinic, Brain Health and Chiropractic, is focused on complex neurological cases, and we utilize our 4-day brain reset program to help these cases. We see adults and pediatrics. With a lot of our adult population, we'll see chronic dizziness, post-concussion syndrome, dysautonomias and POTS, head pressure, and balance issues. With our pediatric population, we'll see a lot of ADHD, autism, emotional dysregulation or behavioral issues, and coordination issues as well with kids. When I first started my practice in 2020, I started seeing a lot of long haul COVID patients with post concussion syndrome, and that's what kind of took off the practice because I was seeing a lot of dysautonomias and those sorts of things with it. As we're in South Dakota, word of mouth goes around, people know each other. I'm from a small town in South Dakota, New Holland, South Dakota, really small town of 60, related to 40, which is a fun fact about Dr. Cooper. Um, as word got around, I started taking in whatever cases were brought to me. I started seeing an awful lot of kids with ADHD and focus issues, and I would do my exact same exam that I would do on an adult. I would check the eyes, check the balance centers, check the neck, see how the coordination was, and I was finding all sorts of deficits that were the exact same. These kids were getting medicated for underlying neurological dysfunctions and deficits. I started seeing results with focus and attention and emotional regulation, and kids were doing better in school, and families were a lot happier because those kids were a lot more emotional regulated at home, and they can see the potential that they knew was in their kid. They're starting to see that a lot better after doing the therapy. If you've been diagnosed with ADHD right away, like in the early phase of this, and been told to take medication, you got to start with an exam and try and look at the deficits first in the brain. You got to at least rule it out. Are there primitive reflexes that are still active? Are the eyes tracking? Is the balance good? Like, you got to see the brain. If you think of the brain as a muscle, how strong is that muscle right now? Because, for an example, like if primitive reflexes are still active, if you look through the symptom list of some of these primitive reflexes, and those are supposed to go away in the first 2 years of life, if those primitive reflexes are still there, every single one of them, a symptom is ADD, ADHD. And so if you're helping your kid, you want to take I'm a parent as well. Like you want to take a non-invasive approach before trying a medication because that can affect a lot of different systems in the long term. So doing a non-invasive therapy plan or just starting with an exam and pursuing a care plan that's non-invasive can be a great place to start with a kid. So a primitive reflex is a reflex that is housed in our brainstem and we're born with them. It's kind of a weird example, but if a deer is born, the deer knows how to walk and that's reflexive. Like it didn't watch mom and see how to walk, right? When we're born, we have reflexes that are integrated into our nervous system, into our software to basically like a moral reflex is going to allow us if we like move too fast backwards like we're falling, like we'll start crying as a baby and feel like kind of scared, cry for mom and cry for help. There's sensory reflexes like on the face, like if you kind of swipe your hand across here and you'll move that way, that's for breastfeeding and those sorts of things. And then there are Babinski reflexes or plantar reflexes on the bottom of the foot that'll keep us crawl in the crawling phase long enough before we start walking because you don't want to walk too early either as a baby. If those reflexes are still there after 2 years, that can create a lot of issues later. It'll create a lot of fight or flight in the brain that's not necessarily supposed to be there. So, say the kid is 6 or 7 and they're in school and they can't focus and they're going to be naughty in class and stuff like that. I like to think of their perception thinks that there's a tiger in the room because they have so much fight or flight in the brain. It's not that there's actually a tiger there. Perception thinks there's a tiger there. So as we start kind of erasing some of these stressors on the brain, taking the primitive reflexes away, getting the eyes tracking better, getting the balance better and the coordination better, start erasing that tiger out of their perception. And then they can start focusing on the things that are at hand, like the frontal lobe activities, like reading, focusing on what the teacher's saying, doing homework, and those sorts of things. One of the questions that I get the most in the office is like, why does my kid still have these primitive reflexes? The obvious one, like the most easiest one to communicate is a concussion. If the kid hits their head, then you can see some of these, especially in those first 2 years of life. If the kid hits their head, that can kind of slow down your development. Another example, if a kid gets really sick or has like some sort of viral sickness, like during their crawling phase, they're not going to move as much because we are developing at hyperspeed in those first 2 years. So even like it can be detrimental to not be able to crawl much like during those 2 weeks while you're developing those centers.
My interest in working with a pediatric or a younger population stemmed from my own exposure to post-concussive syndrome. So when I was in middle school, I had some significant concussions, multiple right in a row, and at that age, saw the trainer, saw the kind of did the traditional medical route, which is important, but also nobody knew what to do with me when I wasn't getting better. Was still struggling with light sensitivity, focus issues, headaches, just academic struggles, things that I had never struggled with before, and nobody really had answers for me. And so that made me super passionate about wanting to learn how we can help other people that have struggled or that are struggling with symptoms like that, either from a concussion or from birth or struggles that have followed them for many years. What got me interested in pediatrics and working with the younger population specifically is my interest, personal health journey with struggling with some post-concussive symptoms. So when I was in middle school, had some significant concussions and wasn't recovering from them like people would expect. I did the traditional route, was seeing the trainer, saw some specialists, and was still dealing with symptoms like light sensitivity, extreme light sensitivity, significant headaches, and focus issues that I had never had before. And just kind of didn't know where to turn. Struggled with those symptoms throughout high school, throughout a little bit of college, and kind of just have had some lingering symptoms. So, in chiropractic school, I learned about how we can address some of those symptoms and really went into the niche of functional neurology and how we can address those symptoms and how we can support kids specifically that have those symptoms from a neurology perspective, and just want to be able to help as many people as possible who struggle with those symptoms either from birth or from a young age or from an injury or an illness, such as kind of my own story, and want to be able to help as many kids as possible. ADHD is something that a lot of kids are getting diagnosed with at an earlier and earlier age, it seems. The traditional medical route is to treat the child's symptoms with medication to try and suppress the hyperactive feelings, the impulsivity. Here at Brain Health and Chiropractic, we look at addressing the child's symptoms from how their brain and body are communicating. So looking at how the eyes are working, how the postural centers are working. Do they have primitive reflexes that are impacting their ability to focus every day? Hemispheric imbalances that could be impairing coordination and things like that. And we just try and do a whole body approach and determine what systems we can be improving that will help promote focus and coordination and attention and help behavioral regulation. When a child comes into our office, one of the first things we do is an initial exam. And that initial exam looks at how all the systems in the brain are working together. So, how the eyes are working, how the balance centers are working, how the primitive reflex systems are they integrated? Are they not integrated? Are they affecting one side? Are they affecting the other side? And from that long and comprehensive exam, we have a really good picture about what areas of the brain we can be optimizing, and we base our treatment plan upon that. When parents often come in and bring their child in for an exam at Brain Health and Chiropractic, their biggest thing is, I just want to know if we can make things easier for my child. Oftentimes, they're just frustrated. They know that there's like a missing piece or something. They're wondering if there's something that we can do that makes everyday life and academic learning easier for their child. And we just want to let them know, absolutely, there is. So, something that we often see for parents, just changes within their child, is their ability to feel more calm in everyday life, feel like there's less stressors in the room, and that can so impact a child's overall demeanor and behavior with life. The results that we have seen in kids following our intensive therapy include just better emotional regulation. Some parents, often one of their complaints is, my kid just has a short fuse, and all of a sudden they can make it through the evening without an outburst. We can do our homework with less battles. We can sit through a day of school without being so frustrated, things like that. And just knowing for parents that there is hope, things can get easier for their child, and that there is hope for better functioning and just easier days for your child ahead. Emotional regulation is the body's ability to feel calm or feel grounded regardless of the environment surrounding them. So, a lot of our kiddos with ADHD often feel overstimulated really easily. And so, just being able to understand that from their perspective, there's a lot of stressors that are upregulated or that bother them more than other people might experience these same stressors. And so, being able to downregulate or being able to improve their stress response, we kind of give the example of takes the tiger out of the room, takes the big stressors out of the room so that they can regulate a little better and be able to focus and feel calmer inside. When we lack emotional regulation, it means that perhaps our environment is causing us more stress than it might for the average person. One thing that we see in a lot of kids is kind of something called a moro reflex. A moro reflex is a primitive reflex that's present in babies as a survival reflex. And when it's still active in kids, it means their body is more likely to always be in a state of fight or flight. It's called sympathetic dominance. And so, if we can get rid of that reflex through different mechanisms of supporting the brain systems, it can help kids have better emotional regulation and feel less stress all the time. When parents first come in to see us, some of the biggest challenges that they see for their child is just sleep issues is one of the big things. Inability to either fall asleep, stay asleep, or wake up earlier than they should, just kind of always feeling restless. One of the biggest improvements we see is that first week or even during therapy is their child just feels more grounded, less stress response, better sleep quality, better sleep promotion, sleeping a little bit longer, and that works wonders for setting them up for a better day, right? Another struggle that parents often notice in their child that they just want to see if we can improve is coordination. Some of these kids, they're trying so hard, but they're just a little bit awkward in their bodies, feeling uncomfortable in their bodies. And that can absolutely make sense why they would feel hyperactive or on edge all the time. And so that's something we also notice in children pretty early on is their ability to just have better control over their bodies, feel more grounded in their bodies, and feeling their bodies is a big deal. One of the biggest reasons for impulsivity and kind of restlessness is not being able to feel your body or feel grounded within that. And that's something we're really working on over our intensive week and through our treatments here. With the kids we see in our office, another frustration that a lot of parents come to with us is difficulty with fine motor coordination. So, tying shoes, buttoning buttons, writing, fine motor skills with our fingers. And that's usually not something we chase because primarily we want to support the gross motor systems. Because oftentimes, if we have difficulty with fine motor or smaller tasks with our hands, we have an inability to control our postural centers and feeling our body as a whole. So as we work on gross motor systems, it does improve fine motor systems and hand-eye coordination, and that's a big change that a lot of parents see following our therapy. With ADHD, often another common complaint within our parents is their kids have difficulty falling asleep. They're too wired and tired to fall asleep at night, or we wake up frequently, or we wake up earlier than parents would hope, or earlier than expected. We would hope we could sleep through the night without interruptions. And that's a big change that some parents see early on in our care. It's just a change to their sleep habits. And if you think about the big change that that can create for the trajectory of the rest of your child's day, better night's sleep, better emotional regulation, and that's how better sleep can impact the whole day. So, our eyes' ability to stay stable and work together as a team has a large impact on our ability to focus. And if we're not addressing how they work together as a team and how they move together, such as for reading or eventually for driving and things like that, the ability of them to stay on target and work together has a huge impact on focus. And so, if we can improve the systems that cause more stability within the eyes, that regulates or that translates into better regulation of being able to stay on a task.